Hello everyone. Welcome to Health Korea Solutions. So today we will discuss about one of the most confusing topic that generally coders find it difficult to understand initially. So it's the concept of ostomy coding, be it attention, be it current status, history, reversal or takedown, and malfunction or complication. Now, first of all, let's understand what is the meaning of ostomy. So it is generally an artificially created opening. It could be used for different purpose. In case of colostomy, it is to drain out the waste material. In case of tracheostomy, it is for the prolonged ventilation, or in case of gastrostomy, it can be used as the feeding tube. So it differs from ostomy to ostomy for what purpose it is being used. All right. So right now we will look into the indexing part. How do we lead that ostomies in the ICD-10 guidelines or book? Okay, now here you can see colostomy. There are multiple subtitles to that, or multiple indentations you can say. All right, under colostomy you have the attention code, under colostomy you have fitting or adjustment code, under colostomy you have malfunctioning code, under colostomy you have status code. All right, same goes with the tracheostomy, the first one being the complication, as it starts with C and then followed by status. Under status you have attention to or malfunctioning, and same goes for the gastrostomy as well, only attention and status. Okay, so here we do not have any malfunctioning or the complication code. All right, now how to understand or how to differentiate between this attention code? When do we capture the attention code? When do we capture the malfunctioning code? When do we capture the status code? So all these differences we will try to understand in our next slide. All right, okay, so this is typically pertaining to ICD-10 guidelines itself. So under attention, the code series would remain Z43, all right, or Z43, however you can say it. Now, which means whenever a particular patient comes to a inpatient ward or outpatient ward or clinic anywhere, that patient has already undergone or already placed with the ostomy, whether it is tracheostomy, colostomy or gastrostomy. It was already done on the patient, okay, for the respective purpose, as I already mentioned. Okay, now if that ostomy is having some problem, example like clogging, okay, or any other problem that patient is finding it difficult to continue with the ostomy, respective ostomy. Okay, so in that case physician will check out, okay, or physician will interrogate, that is also called as interrogation. Okay, or they may even come for the routine checkup also. So after the routine checkup, if they may find like there is any issue with that particular or any problem with that particular ostomy, and they are taking care of it, they are resolving the issue, treating it, in this case you can capture the attention code. Why? Because the surgery was already performed previously, the artificial opening was created already previously prior to this visit, but currently patient came only to get some attention towards his or her respective ostomy, and that is being done. So that is the reason we capture attention code. So it will be denoted by the Z43 series. So be very sure about this one and the status code. There is a huge difference. Now moving to the status code, it indicates with Z93 series. Okay, now what kind of status we capture? When a particular ostomy is done previously and the same ostomy is still present, say for example prior to a week a particular patient was placed with the ostomy, be it colostomy or tracheostomy, and patient today came with the same tracheostomy or the colostomy, okay, and it is still present without any issues. So just in order to indicate that patient is colostomy compliant or patient is already having a colostomy in place, so in order to indicate that status, I need to mention Z93 series code. All right, now you should not get confused with the history code and the status code, because here it was already performed previously, it was not currently performed. If it is currently there, if they are currently performing that ostomy, then it won't be an ICD code, it will be a surgery code, but ICD is actually the diagnosis code. So here we are capturing the status of diagnosis. Okay, we are not capturing, here we are capturing that status code, which is a diagnosis code for that procedure. Okay, but it is not the actual procedure code. We are just capturing the status code. All right, so how to identify that? I have given you some example. Under past medical history, you may have colostomy performed documented, but under physical examination, it must be documented either in physical examination or any of the present evidence that patient's ostomy is still present. Or sometimes you may get the documentation like ostomy is pink in color or ostomy is significant. So these are the terminologies you can get to have the presence evidence of the ostomy. Okay, now let's move to the history code, when you should not code this Z93. Say for example, previously it was placed but it was taken down or reversed. Physician has clearly documented that ostomy was or ostomy reversal was done or ostomy was taken down, which means it became a history code, right? Example like PMH, past medical history of colostomy, but presently there is no evidence to indicate the current existence of that ostomy. So in this case, we will not be capturing Z93 series, but in above case, we will be capturing Z93.X series. All right. Now move to the malfunctioning. Here, when a particular ostomy is not operating well or it is not functioning properly, it may require a replacement. All right, replacement. That's these cases like we capture the malfunctioning code. All right, now last but not the least, we have two more categories that we can look here in our previous slide, like fitting or the adjustment. If patient comes for the fitting or the adjustment of the colostomy, you can capture this Z46.89 code. All right, and under tracheostomy you have the complication code. If there is any complication associated with the tracheostomy, patient is coming for that, you have to capture the complication or the complication code for the tracheostomy. Okay, so I hope I have cleared like the maximum doubts related to this ICD-10 guidelines pertaining to attention, status or malfunctioning of any ostomy. So if you have any question, please don't feel shy or don't hesitate to put the same in your comment section below. So thank you very much. Please do like, share and subscribe.